Good evening, everyone, and welcome to the April 8th, 2025 meeting, the second Tuesday series of the Auxiliary Markings Club. We're glad you're here, and we're glad to have a fine group of attendees in person tonight. If this is your first time here, welcome. We're glad you're part of it. And for those of you, depending on when you're listening to this or where you are in the world, as another august presenter at these things like to say good morning, good evening, good afternoon, wherever you are. So we're glad you're here as well. Just a few quick commercials. If you're not a member of the Auxiliary Markings Club, you absolutely should be. Digital memberships are available for $15 and print memberships for $22. We have a wonderful website which has recently been reworked by Doug Quine, who has been our webmaster from the get-go, and he's one of the founding members, so we're grateful to him for that. We have a wonderful newsletter. We also have a YouTube channel on which all of the previous YouTube Second Tuesday programs appear, and we have a Facebook page which features markings from all over the world, and there's a new marking and write-up every day. So if you're interested in things like that, which you obviously would be because you wouldn't be here if you weren't, then you will find it a interesting and diverse group of Facebook posts. I also wanted to point out that we've just finished our first anthology, Considering Auxiliary Markings, which was published together with our friends from the Philatelic Specialist Society in Canada. It's a wonderful collection of articles and very, very diverse collection of articles from any number of authors from across the globe, and they're writing about a very wide view of this topic. So that is available from the Auxiliary Markings Club website, and you can download it for free. So welcome to our presenter, Andrew Kelley, tonight. Andrew, for those of us that are involved in the Auxiliary Markings Club, is certainly no stranger. He serves as our vice president and also the editor of our newsletter, and he's really a remarkable person in terms of the diverse talents that he brings to help this club function and thrive. So Andrew's philatelic journey began in fourth grade with a beginner stamp album. Hang on, I have to reduce my thing a bit there. A beginner stamp album from his club's book club. After attending the APS summer seminar several times, Wayne Youngblood and George Brett taught his first class. That must have been quite something. He assembled a successful national and international youth exhibit. Following a break for Harvard Law School, family, and early career, Andrew returned to the hobby roughly 8 years ago. Since then, he's written extensively about the U.S. Washington Franklin heads and related postal history, earning the United States Stamp Society's 2023 Hopkinson Literature Award for one of his articles. He is the editor of the Auxiliary Markings newsletter, which is the journal of the Auxiliary Markings Club, as we mentioned. He also co-chairs the U.S. Stamp Society Washington and Franklin Committee and serves on the APS Expert Committee. His exhibit on offset lithographed Washington Franklin heads won the 2023 George Brett Cup and other awards, including 2 Grand Awards, and has been recognized several times for excellence in exhibit text. Outside of philately, Andrew is a business litigation attorney. Throughout his career, his practice has focused on editing other lawyers' work to ensure that it's clear, concise, and persuasive. Finally, Andrew's a semi-professional outdoor photographer, photographer. I don't know where that came from. He has taught many classes about preparing images for publication using Adobe Photoshop and other tools. He lives in Denver, Colorado with his wife and his children. And he's also a recently minted, fully fledged philatelic judge and the editor of at least one other journal that I know of. So a busy guy to say the least. So Andrew, we're going to turn it over to you, and thank you for sharing with us tonight.
Great. Thanks, Greg. Let me share my screen here. As Greg said, I think this will be most useful if folks feel free to interrupt me as we go. Uh, we have a limited amount of content, so I think that will work out well. I should also say I've not had to move house like Greg has, but it's been an exceptionally busy couple of weeks for me, and so um, I'm somewhat tired. So I start talking too quickly, feel free to interrupt me and tell me to slow down. I will not be offended. All right. We are here today to talk about 20th century United States disinfected auxiliary markings on mail. Um, the most of the action in the 20th century, as you will see, is in the first 20 or 25 years. I think people took a different view of disease control. After that, not a lot of disinfection until the anthrax scare in the early 21st century. So most of this will be focused on that earlier period. And this largely reprises material from the anthology that Greg mentioned. And so we'll pull that up on the screen again at the end. But if you're interested, please feel free to take a look at that article. Also, feel free to reach out to me directly. I love talking about this stuff. And I think this is one of the reasons that this is an interesting subject is that it's poorly documented. There's lots of discoveries to be made, lots of research to be performed, and so I hope that folks who see this might have an item in their own collection that would help advance knowledge and would let me know about it. And then lastly, I think this is interesting. Interesting for several reasons. Most of this material is quite hard to come by, which makes an interesting collecting challenge. Also, I think there are very few areas of philately that I can think of that have more poignant stories. As we see today, there are stories about people moving away from their family to go to a tuberculosis sanitarium, or young people who fell sick while they were serving in the military in the run-up to World War I, or just people who were hospitalized with disease. There are a lot of really interesting sort of human elements to this, and sad human elements in a lot of way. And as I said, we have some documentation, but there's still a lot of work to be done, which is something that I like. The way we'll organize this today is to go sort of through the various examples of 20th century disinfection markings that I am aware of. You'll see that we're going to spend a lot of time on Pennsylvania, and we'll talk about that in a little bit, but for unclear reasons, most of the action here is in Pennsylvania. And as I mentioned, I am working towards a better catalog. So if folks have things in their collection or ideas about that, please tell me. All right, first up, in no particular order, or I guess maybe in alphabetical order, there's a report of a disinfected marking from Minneapolis, probably during a measles outbreak, which is a pretty common thing. Unfortunately, this seems to have been lost to philately. It's not illustrated in the best auction catalog of this material that I've seen. It hasn't shown up in any of the exhibits that I'm aware of. And so open question about whether that exists. If you see it, tell me. Next up, and this is a poor illustration, I apologize, it is also from an auction. We see here a really interesting auxiliary marking. You can see it says fumigated health department, set in 1918 during the Spanish flu pandemic. Interestingly, this is the only example I'm aware of disinfection that happened on incoming mail. Normally, it was mail of a sick person will be disinfected before it was posted. Here, some towns in the Ozarks were trying to protect themselves from the pandemic, and so they reportedly fumigated incoming mail in cooking stoves. This is extremely rare. The picture you see here is the only example I'm aware of with this marking, but interesting period. Next up, again, going more or less alphabetically, is a auxiliary marking from Clackamas. I think that's how you pronounce that, in Oregon. The mention of the assistant surgeon and the Oregon infantry suggests that this was a military marking. unfortunately, is not the reason for this marking is undocumented. Too early to be Spanish flu. Sort of unclear what the motivation was behind this disinfection. And that leads us to Pennsylvania. As I've said, Pennsylvania is unusual in that nearly all of the disinfected markings were generated there by sanatoriums and by hospitals. It is unclear why, right? There were a large number of sanitariums across the United States in the time period that we're examining. You can see an example on the screen from a sanitarium in Maryland. And yet we don't see those markings on mail from hospitals or sanitariums really anywhere else in the country. I suspect that there's some obscure Pennsylvania law that's been driving the sort of trend towards disinfecting and marking the mail in Pennsylvania. But so far, my searches there have come up empty. I'm a lawyer. We have lots of good resources, but the coverage of the 1920s is a little thin without actually cracking some books open. If other folks have theories or ideas about why Pennsylvania, I'd like to hear them, but my guess is either just custom to cold air of marking mail, or there was some legal requirement that we're still trying to uncover. So first up, there are 2 hospitals in Pennsylvania that marked mail. The first one is the Philadelphia Municipal Hospital. The longer name is the Philadelphia Hospital for Contagious Diseases, which would give some indication about why they marked their outgoing mail. The evidence suggests that this hospital, and the one we'll talk about in a minute, marked mail sporadically. There are only a handful of markings from hospitals in Pennsylvania, and at least in some cases, we see the same hand stamp used for 20 or 30 years. Until recently, we thought mail from the Philadelphia hospital was quite rare. There had been about 10 examples recorded. I was lucky enough, though, to find on eBay a correspondence from a single patient who was a prolific writer and bought several dozen cards like the one. Oops, sorry. There we go. Like the one that you see on the screen. Interestingly, I think that this hospital required patients to use postal cards to ease fumigation rather than using letters. As I've examined this correspondence, like the one you see there, the young man who was hospitalized would write half a dozen postcards to one person, continuing his message from card to card to card to card. The only reason I can think of to do that is because it was easier to fumigate something that wasn't enclosed. Only one marking from this hospital. It looks like the mark you see on the screen, probably used for a long period of time. All the strikes of that marking are poor. It looks like it's a rubber stamp that was probably disintegrating. But that's Philadelphia. The Pittsburgh Municipal Hospital also disinfected mail. Again, it appears that their disinfection was infrequent. Very few examples known. The cover you can see there is from the only known correspondence with what we call the Type 1 Pittsburgh municipal marking. You can see it's a large marking. There's a gap between the first 4 letters here and the balance of the mark. All examples are like the one that you see here, struck in red from the Lilly Binger correspondence, all struck on the back, and all from the same period in February and March 1920. The hospital evidently had more than one type of mark. We found a single example of what we call the Type 2 marking. Again, you can see stamped on the back, large marking, magenta ink. Interestingly, there are 2 features of this cover that are interesting. The first one is that it appears that the corners were clipped off, likely to admit fumigant into the envelope. And I think the second thing that's interesting about this correspondence is that it was sent from a doctor. The original enclosure is still with the with the cover, the doctor reported that he had contracted diphtheria and wrote to his correspondent that he was embarrassed by that. He'd been in bed for 9 days. It was a nice thing for a doctor to get to be here for a few more days. He'd only been to the hospital for a week before he got sick, and reports treating smallpox, chickenpox, scarlet fever, diphtheria, and mumps. So interesting story, interesting cover, and as I said, this is the only example that's been reported of this particular marking. The other big place where there's lots of disinfected auxiliary markings are from the Pennsylvania sanatoriums, right? Folks know turn of the century, a big wave to build these sanatoriums up in fresh air in the hills. The idea was to provide the patients with fresh air, with milk was a popular thing, a healthy diet, hoping to nurse people back to health and presumably keep them from spreading tuberculosis to their family and acquaintances. Interestingly, by 1917, the United States had over 200 sanitariums, and over 500 by the early 20s. But interestingly, we only have disinfected markings from 3 in Pennsylvania: the Crescent, Hamburg, and Monte Alto sanitariums. And we'll talk about each one of those in turn. Crescent, you can see there, it was opened in 1913. Had a relatively large capacity, 300 patients. It continued until 1956, when it was renamed as a state hospital. Disinfected markings from Crescent are reported from a pretty short window of time, from February 1913 through December 1915. All of the markings use the same distinctive italicized font with serifed letters. Some markings have a period at the end, as we'll see. Oh, sorry, my dog is back and bothering me. And some markings don't. We suspect that is just an artifact of how the marking was struck, or perhaps where on the marking. These are sort of in the middle of the pack in terms of scarcity. There are about 26 examples recorded, 12 with the period at the end of the marking, and the balance without. Again, almost all of these are on postcards, as you see there on the screen. There are a handful of examples of the marking on cover. The one that you see here is one of 2 reported examples. You'll note this one has the period at the end of the marking, unlike the one we saw on the previous screen. And again, like the cover we saw before, the corners have been clipped, again, likely to admit fumigant into the envelope. The second sanitarium that disinfected its outgoing mail is Hamburg. See a picture of it there on the screen. Hamburg opened in 1914. It also continued operation until the mid-50s. Interestingly, it conducted some of the first chest surgery to treat tuberculosis. And in 1918, its capacity was 480 patients. There are very few markings reported from Hamburg. Only 4 have been reported so far, all in the 1915 to 1916 period. You can see an example of these on the screen. Really tiny font, as you can see there. They're only about 1.5 millimeters tall, all caps. And as I mentioned before, there are only 4 of these reported. So it appears that Hamburg disinfected its mail for quite a short period of time. On the other side of the coin is the third sanitarium. This is Monte Alto, I think is how you pronounce that, or Monte Alto. It was the largest sanitarium, I believe, in Pennsylvania at the time that we were considering here, and it produced by far the most disinfected mail, at least the most mail that was marked. It was in operation from 1907 to 1918, and it changed its name. At its peak, the sanitarium had over 1,000 patients, and it marked mail from 1909 through 1914. And overall, we'll talk about the varieties of markings on the next slide, but there are about 100 examples of the various markings from this sanitarium recorded. Here, there's also a great deal of confusion about these markings. As I said, all of these are poorly documented. A guy named William Sandrick took a stab at categorizing and describing the markings over time, and really did sort of did the foundational work there. Unfortunately, though, there are some errors. Sandrick calls the same marking different types in different work, and Sandrick categorized the markings or applied a numbering system based on when he found a cover, rather than sort of categorizing them in a sensible taxonomy. And so in the article that I wrote, and as you see on the screen, I think the better way to categorize these markings is by their size, and then perhaps by the font, or by the misspelling. As you can see there, we have a tall marking, a medium marking, and then we get to the short markings. The sanitarium had a period where they misspelled disinfected, and then corrected it. And so really sort of the best categorization is size, I think font and spelling, or maybe size, spelling, and font. Sandrick also spent a great deal of time thinking about whether markings had periods or not. And he would describe markings with and without a period at the end of the disinfected as different types. But since he did that, and as he acknowledged, it's become clear that probably the same hand stamp made the mark with and without the period. And the sort of definitive piece of evidence for that is this card in my collection. For reasons unknown, the sender of this card or the person who disinfected this card went ham and stamped it, I think, 19 times. But if you look closely at it, some of the markings show periods at the end and some don't. For example, and again, based on the strength of the marking. So this marking here at the sort of bottom center, no period at the end. You can see the period more clearly on some of the other marks. After Sandrick saw this, he decided that probably the with and without period wasn't a meaningful distinction. And I think that he's probably right about that. Greg, it looks like there might be someone in the waiting room. Should I admit them? I guess I will. Okay, so anyway, first example of the tall marking, where our taxonomy is size, and then font. Because I think, given the range of time involved, the facility wasn't very picky about what ink they used. We see most of the markings struck in red ink and black ink. There's a black example. Here's another red example. This is by far the most common style of mark from Monte Alto. A much less common marking is what I've called the medium height marking. This is sort of halfway between the tall one and the short one. There are only 13 examples of this marking known. Sadly, I do not have one of the 13. This one's from Sandrick's exhibit. But there's a few of these lurking out there, and they are quite hard to come. And then lastly, we see that the facility used this, what we call the short marking. There are two types of this marking, one with fonts that have a serif, one without those serifs. The example you see on the screen there is the earliest reported use of the mark, but given the small sample size, I'm not very confident that we won't find an earlier one. Like many other examples we've seen, virtually all of the items from Monte Alto are postcards. Again, we think that's probably because it was easier to fumigate those. There are 2 or 3 covers reported. Here's one of them, unfortunately, roughly opened. But at least a few, particularly in the later period, made it out of Monte Alto. A few covers made it out, as opposed to postcards. Interestingly, given the scope of the influenza pandemic and its impact on young folks in the military, there are surprisingly few disinfected markings from folks in the service. Aside from that one we saw at the beginning of the presentation, this is the only one of which I'm aware. The Portsmouth Naval Hospital started using this sterilized stamp during a measles outbreak in 1918, before we think it it was really swamped with the influenza. We know the hospital treated a large number of influenza patients. It appeared maybe they were so overwhelmed that they stopped using the sterilized marking or maybe stopped disinfecting mail, as the examples that we see are mostly predate the flu pandemic. And then the last example that we know of is a fumigation in Seattle in 1915. Interestingly, this marking was applied by the quarantine department, which suggests that Seattle had an active infectious disease program. The available evidence suggests that this letter was fumigated during a mumps outbreak in Seattle. But this tends to be extremely uncommon mail. This is the only example that I have seen, and as you can tell by the poor illustration, is from an auction catalog. And then, as Greg said, if folks are interested in more information, if you want a citation to all the disinfection literature that I'm aware of, please pop over to the Auxiliary Markings website and have a look at the anthology. My article in the anthology has a much longer description of these covers, but then I think a complete bibliography at the end. And I'll say one more time, I'm confident that that my sort of categorization or collection of these items is incomplete. And so if you have a disinfected item in your collection from the 20th century US, or you know of one, or you see one in an auction catalog or on eBay or the like, please let me know. I'm trying hard to rationalize this material and sort of better describe it for future collectors. And Greg, that's it. Are there questions?
Yeah, thank you, Andrew. That's it's very interesting stuff, and I think quite rare, as you've pointed out. Anybody have any questions regarding what's been presented?
Andrew, hi, this is PK.
Hi, PK.
Thank
It's nice to meet you like virtually.
Nice to meet you.
Yeah.
So, thank you. Excellent presentation, and really learned a lot. My question is around the requirement for disinfection. Was this just done by the various sanatoriums and hospitals because they felt it needed to be done? Or were there any postal notifications or health department notifications requiring mail from certain places to be disinfected?
It's a very good question. I found some military regulations that concerned disinfection. They were more on the lines of specifying how to disinfect mail rather than laying down requirements for when mail might be disinfected. They would talk about exposure to formaldehyde fumes for 30 minutes, things of that nature. I strongly suspect, given the available philatelic evidence, that outside of Pennsylvania, individual local governments took it upon themselves to disinfect mail because they thought it was appropriate. It's just too scattered and infrequent, I think, to be anything else. If there was some broader postal regulation, we would see much more disinfected mail. I think, on the other hand, that there must have been some requirement in Pennsylvania to disinfect the mail. As I said, I've done some preliminary legal research to find it, so far unsuccessfully, although I've not given up. But very likely it would be a state law that would talk about appropriate handling of mail. And the reason I think that are several. First, as I said, just the overwhelming volume of mail is from Pennsylvania. Like 98% of the examples or something like that are from Pennsylvania. I can't think of a good reason for that other than some legal requirement. And then the other thing you see is, particularly with, I think, that Pittsburgh hospital stamp, that we found covers that are bracketed by like 20 years. And so clearly they had this stamp. It's quite obviously the same hand stamp, given the defects and weird spacing and all that. Clearly the hand stamp was in the drawer. And then when some particular condition was triggered, probably a pandemic or a disease outbreak, someone got it out and stamped the mail. And so that, at least to me, suggests some requirement that they would, during particular disease outbreaks, that the hospital would disinfect its mail. but that's definitely a subject for further research. And if other folks have ideas about why so many Pennsylvania markings, I would love to hear them.
Thank you.
Rick Lawrence is there.
Andrew, and please all forgive me. I'm a musician and science is not my background. Was there any actual evidence that these pieces of mail could be infected and that doing what they did to them actually prevented further spread of infection?
I think it depends on the disease. I think, for example, the risk of getting tuberculosis from correspondence is quite low, whereas maybe the risk of measles, for example, would be much higher, just be given how infectious that it is. There are, and I have to go back and look at them. It's been a minute, but this area of philately got a lot of attention from doctors in the late 70s and early 80s, and so there are a few articles that I cite in my longer article that talk about that. I don't think they're quite as concerned with the efficacy of disinfection as with the sort of methods and when and where. But they at least seem to take seriously that this would be it wasn't completely a quack practice.
Right.
Andrew, I enjoyed the presentation, and just out of the clear blue, and I have no idea if there's any background here or not, but the name Emily Bissell pops into my head, and whether there's any geographical relationship of her facilities here in Wilmington, Delaware, to what might have happened in Pennsylvania. Now that's Lancaster County and so forth, but do you come across any references?
I haven't, but I think that bears some further looking.
Have you done, Andrew, have you done a search? We all have our ways of searching for material we want that focuses on the individual 200 sanitariums that existed in the US at the height of this. In other words, looking for material based on sanitarium X and the 40 things that you will find that don't have any markings on them, but the one that you might. Have you done anything like that?
I have. Yeah, I have a few standing searches on eBay, including for words related particularly to TB, right? Sanitarium, TB, tuberculosis. That's how I found that card I showed you at the top of the presentation. So far, not a lot. It really does appear to be largely concentrated in Pennsylvania,
Mm-hmm. Mm-hmm.
with a few the exceptions that we saw.
Yeah.
I was thinking it was interesting, fascinating talk, and your papers as well. I spent some time in the 21st century worrying about this problem after the anthrax attacks. And the first thing that struck me that was interesting about your talk was that your people were worried about outgoing mail. And because the sanitaria and the hospitals obviously were concentrated sources of infection. And then, of course, with the anthrax attacks, the problem was reversed because it was a terrorist creating an attack and people were scared of incoming mail. So that sort of changes the whole mindset and the approach. But I think from the scientific validity, I remember there was a lot of talk about the things like flu that are passed by aerosols, and flu doesn't do very well once it dries up. So if you're picking things up in the proximity of other people, you have a high risk of getting sick. If you mail it to somebody, by the time it gets to them, the letter's probably dried out enough that the risk is very low. And, all these people who are putting their mail in the oven or, aging it for a week before they opened it or something were kind of laughed at. In terms of aerosol transmitted disease. Now, of course, in the case of anthrax, it was very different because it lasts for hundreds of years. But it was interesting, the outgoing versus incoming. And the other thing that struck me was with the fumigation and cutting the corners of the envelopes, and that persisted into the 21st century, actually. And again, if there's powder in an envelope, cutting it is a very effective way of being able to detect it also, because it spills out. And I can remember when I was helping set up the House of Representatives mailroom for security screening in a little after 2000, they required the corners of all the mail be cut. And there were really two reasons for it, we learned. Reason number one, again, fumigation and seeing any powder coming out. But then they required that the postcards have their corners cut. There's not a lot of powder coming out of a postcard when you cut the corner. And if you think about political campaigns, people, the different lobby groups mail millions of postcards to the senators and the congressmen. And so you get these massive stacks of postcards, and all the corners have to be cut off. And the instruments, the equipment required to cut the corners off 1 million postcards is quite an undertaking.
Yes.
And, the scientific group involved objected. We didn't think it was reasonable to go through this incredible amount of work to do something that had absolutely no effect on the objective. But the argument was that it showed to the recipient that it had been through the process.
Disinfected.
Yeah. And there actually was no disinfection being done. It was only screening and corner cutting. Oh, I'm sorry, there was X-ray. There was X-ray disinfection, but that goes through without a corner. So cut. So I don't believe the corner cut did anything except maybe release some powder from an envelope.
Well, it's fascinating. I have thought I probably don't have the right background to do it, but to your point about different approaches at different times, I think it would be fascinating to zoom out a little bit and look at the history of medicine and the history of our understanding of infectious disease and the sort of the prevalence of disinfection. Because if you look at it, the episodes of disinfection are not spread evenly over time. And to me, they don't even appear to correlate that strongly with particular disease outbreaks. I think it's, you have a germ theory of disease, and so all of a sudden it seems like a great idea to just better safe than sorry. And then you sort of see that disinfection tapering off with a few exceptions, maybe leper colonies, for example. The leper colony in Hawaii was known for baking its mail, I believe, for quite a long time. But then you see in the 1920s, right, there's this huge resurgence. I don't think I don't have a precise theory of what caused it, but it's quite interesting to see that you go from 0 to 100. And then after 1925, we saw that second cover from the Pittsburgh hospital. That's maybe the last example of marked disinfected mail in the US until the 21st century. Probably for the efficacy concerns that you mentioned. It'd be interesting with someone who has more of a medical background or history of medicine background than me to think about how those go together.
I do know one factoid that helps with that, and that is the first document I found, and I'm not good with Pope numbers, but it might be Pope Pius XIII in the 1600s, put together a very detailed protocol for the disinfection of all mail. And in those days, I think probably royalty and the church were probably the two major sources of mail long before stamps and affordable postage. And it was an elaborate process of punching holes, soaking with vinegar, smoking, all these different things. And it was a several-page instruction of what to do. And the poor characters who were given the opportunity to do it as long as they lived.
Right. I'm trying to see if I can find it on my bookshelf here. I don't know where I put it. I won't make you all look for it. It's cited in my bibliography, but there's a great the 19th century and earlier disinfection is much better documented than the 20th century. And there's a great book that talks about that point that you just raised, although not with all that interesting detail, and then some of the other episodes. And it sort of mumbles a little bit when it gets to the 20th century, sort of mentions a few things in passing and stops. But is it Barnhart maybe? Here I can look. It's worth if you're interested, it's worth a look. I'm sure there's a copy in the APRL.
Right. Well, you definitely picked up the gap in history, despite all of our information. There's a lot of material before you, and there's before the 20th. There's a lot after, but the 20th was just a gaping hole. I'd love to see that article. It was great to see your article.
Yeah, thank you. That's why it's fun to have. It's fun to find something like that that's so poorly documented. trying to find the name of that. Oh, I'm sorry, it's well, Dr. Jim Milgram has a great article on the APS website, which is worth checking out, about the disinfection of American mail, mostly 19th century. And then there's there's one more book that's worth mentioning. I'm not seeing it quickly. I won't make people sit here while I scroll through the bibliography. But anyhow, it's a super interesting topic, and certainly more work to be done.
Do you have any interest in countries other than the U.S.? I mean, I know your primary collecting area is, the U.S., but do you have interest in Europe, or I don't know if this existed in Asia or not at the time, but
yeah, I have thought, and I may expand this collection more broadly. I think that the challenge is that this is extremely collectible mail, and it has to be very popular among lots of different collectors. And so it could be the 20th century US stuff is hard to find and pricey, but some of the classic disinfected mail is eye-watering. But yeah, I thought about that a lot. It's a very interesting topic.
Just putting that together with your earlier discussion of eBay searches and so forth, I trust you're looking at postcard websites and postcard collecting organizations of sorts. I have friends who collect postcards, and I've never asked them about disinfected mail.
I really haven't. That's a good. I mean, my eBay searches would maybe
that's
look it up. I should.
First thing that comes to mind is the postcards.
Yeah, I'll have to do that in my spare time
as a keyword search.
Yeah, yeah, but they're out there. I mean, I think probably most of those postcards we just saw were things that a philatelist found in some postcard dealer's box. There's a lot of finds to be had there.
If I find any on a random search, I'll make sure to touch base with you so we don't bid against each other.
Okay. Well, you have my eternal gratitude.
I think as collectors of auxiliary markings, that's another example of how postcards are an interesting black box, because most postcards are collected by the picture on the front. And I've been to countless places where, of course, they're all oriented picture out. And when you flip them over, there's all these treasures on the back that nobody's thinking about, and fortunately not pricing based upon.
Right.
So it's interesting to go to a postcard display at a flea market or something and turn the box around and flip the deck. And see all
That's their terminology of
marks.
front and back. Our terminology of front and back is 180 degrees opposite.
That's right.
And Andrew, wasn't there a yellow fever outbreak in Florida in the 1930s that had some disinfected mail associated with it?
I know what you're talking about. I think that's right. I think the mail was disinfected in boxcars, as I recall. They burned sulfur in the boxcar to disinfect the mail. As far as I know, none of it received an auxiliary marking. There may be some that you can infer that it was disinfected because it came from the right place and it looks like someone lit it on fire in a boxcar full of sulfur. But to my knowledge, none of that was, at least in the 20th century, none of it was marked.
Anyone else? Well, thank you, Andrew, for a really interesting presentation. And as one of the people who's had several opportunities to read Andrew's excellent article, if you're interested in this topic, you'll get a tremendous amount out of just going to the Auxiliary Markings website and finding his article at the very last one in that anthology, and certainly not positioned by quality for certain.
It was positioned by submission date.
I didn't want to say that. But,
that's okay.
That's okay. So, okay, well, if there's nothing else, I'll just quickly go on to our next.
I'm sorry, just one quick thought.
Please go ahead.
You might be able to look for discoloration and so forth because of disinfection. Certainly in the 21st century, when the X-ray irradiation was being used, which was massively powerful, all the glassine would basically turn brown. and any CDs that happened to be in an envelope would melt. I mean, it was serious high doses. But it's possible that the smoke or whatever would give you some some indication of the color when you're looking quickly through things. And also, if you ever see slits on the envelopes, historically they were the marking of disinfected mail.
Yeah, I think you're right about that. Although certainly a challenge in that the same time period that we're talking about with the yellow fever was the nadir of U.S. paper quality. So, but yeah, I think you're absolutely right. And perhaps if you had the right instrumentation, you could detect excess sulfur on the cover or something like that. But I have not endeavored to do that.
Okay, great. Well, thank you. I can't imagine that anybody will be interested in any presentation by this fellow after Andrew's excellent presentation. But I will say that my contribution to the auxiliary markings anthology was to research the variety of UPU return labels from Yugoslavia after World War One was concluded, and it's a really fascinating subject. All of those Central European newly created countries experienced a lot of difficulty with their postal systems at the beginning, and so there's a lot of variety, and it's a very interesting subject. So I invite you, if you're around a month from tonight on the second Tuesday of May, to join us for a discussion of that. So that concludes our program for today, and thanks everybody for joining us. We hope to see you back again next month. And as I say, if you're not a member, please become one. And if you have an article or an interest that you'd like to contribute, we'd love to hear from you, or a cover that you find interesting. You can send it to Andrew or to me, and we'll make sure that it ends up in the correct place. So anyway, good evening, and thanks for joining us. We'll see you next month.
Thank you.